Hey guys, this is Starkibber. So, I just wanted to follow up with you guys as far as what's been going on health wise. So, I am officially a week post op from having my nasal surgery, and it's been a whole lot better than it has been for the past couple months. The past couple months was just really horrible. For people that don't know, I have like a condition or whatever. It started years ago where these little tumor things start growing like in my nasal cavities and things like that. So or sinus cavities, whatever. And a couple months ago, they were growing in my right here inside my nose, in here and in here. So basically, it just always sounded like I was congested, and I couldn't breathe at all through my nose. Like I couldn't get, especially this, I couldn't get any air through my nose. Not good. So yeah, I hesitated a little bit. I just really, with the healthcare thing, it's like the system. You have to like advocate for yourself, and sometimes sometimes you go through insurance changes and primary care doctors that you have to change and things like that. So things got changed, and not necessarily you have the best not necessarily do doctors even have the best interest in you, personally I've seen a lot of doctors who I feel like just don't care, or they are just they have so many patients to see. It's like, so they're gonna miss something, things are gonna fall through the cracks. All I have to say is advocate for yourself and for your health, and do as much research as you can, with your medical conditions and things like that. So um, with me, I feel like there's a lot of discrimination, for like obese patients like myself, because when you walk in there, they pretty much, I feel a lot of doctors kind of already off the back are like, okay, if you are this many pounds overweight, if you're over 100 pounds overweight or 200 pounds, or God forbid 300 pounds overweight, they pretty much feel like that you don't care about your health, that you just pretty much neglect yourself and things like that. And which is true. I mean, in a sense, I have neglected my health, but not necessarily because I'm would consider myself to be like a glutton or whatever. Um, just basically because I always sort of never cared, you know, never cared about the Care Bear. But it's true. I've never really cared about myself. I've had very severe like low self esteem about myself. Things that I'm still trying to change. I'm 33 years old right now, and I'm still struggling with a lot of my childhood traumas and things that I grew up with that kind of like made me who I am, and that coupled with a bunch of other medical issues and things like that, So it all goes hand in hand, psychological, physical, everything. It's like everything is a manifestation. So your mental and emotional state of mind can also kind of dictate your physical health, like for example, let's say you get depressed, well, hence you might not want to eat healthy because you're depressed. You might gravitate towards eating something that comforts you or whatever. And then that combined with having a messed up thyroid, well, you know here you go, this is the equation here. You know, A plus B equals C. Well, that's kind of how I am. But see, doctors, they kind of like already have in the back of in the back of their head thinking like, okay, this patient, she's at home, she's got 10 cheeseburgers, and she's eating hot fudge sundaes every night, and like, which is not the case with me. You know, it's like, um, do I feel like I overeat? Yes, I have moments of anxiety, and that's mainly my biggest issue is stress eating and anxiety eating, and all I can say is like when I have anxiety and stress, I get like this really um like my stomach gets like in knots. You know, that's how you can explain. You know, it's like, you know, your stomach gets in knots, and I feel like eating kind of like eases the pain. You know, it's like I feel like I have an ulcer, and then when I eat, it like coats it. You know, so I do. I'm just a I'm prone to anxiety. I'm prone to stress. Um, when you have high levels of cortisol, like I do from Cushing's, your body is like you're in a constant state of um of stress. You know, so your body's constantly stressed. So, like I said, hence. But like I said, the doctor sees you now. Keep in mind, there is a lot of TV shows that kind of sort of put a negative light to obese people. Like um, like I said, people just assume I'm sitting at home. I've got like 20 cheeseburgers, and I'm eating 20 cheeseburgers, and I'm eating 10 hot fudge sundaes every night, and I don't. Actually, I don't even really eat out. I mean, I want to say maybe once in a while. Like I might eat out like three times a month. Most of the meals that I make are at home. Um, Another thing that I feel like doctors have sort of placed me in that category. Like, oh, you know, she's just sitting at home, stuffing her face, and you know, how could she get to that weight? You know, and I know how I got here. Like I said, it's not just one thing. It's not just the food. Do I consume more calories than I should? Definitely. Is it from a particular source? I would say that I do tend to have a an addiction to food, but at the same time, it's like I fight my addiction every day, and also I guess my biggest thing is having a high carb diet. So I'm eating processed carbs. It's not like, you know, I'm not like eating fruits. Like my carbs are coming from mainly like breads, pastas, and things like that, which I should have nothing of. You know, like that's so like the devil right there. But um also another thing that I gravitate towards eating bread a lot is having gastroparesis, which means I can't like really process or digest food the way I should. So instead of like me being able to eat meat, like I don't, because it's really painful for me to digest it. So like meat will be sitting in my stomach for like a week, and when I do have to go to the bathroom, it's just painful. You know, it's like, and so when I eat bread, it takes a lot of bread for me to like you know feel like I'm satisfied or whatever. So yeah, it's just finding ways of learning what to eat and things like that. But anyways, I digress. I don't know why I went into this topic. I will probably end up posting this in my weight loss channel because yeah. But what I wanted to explain to you guys is my whole situation here with my nose and things like that. That the surgery went well. Um, Obviously, there's always a high risk with a patient like myself who is morbidly obese, and they kind of always have this fear with anesthesia. Not so much the surgery; it's just the anesthesia. That's the dangerous part. And what I'm supposed to do is here's this bottle that they gave me. Is 4 times a day I'm supposed to like do the whole this whole bottle, like pour it inside of my nose and rinse out my nose, which is not as easy as I thought it would be because I hate sticking water in my nose. Like, just hate it. It feels like I'm drowning. And so yeah, even though this should have been a video about my whole nasal things or whatever, um, if you have any questions about that, I'll make a separate video for that. But just wanted to let you guys know that the nightmare is over and that I can breathe and that it's out of my nose. So yeah. So, and I actually do have another video on my other channel when I had them 3 years ago. So this is the third time that I've had them. 3 years ago I had them. I had surgery like in the clinic, so this was not under anesthesia. And then I had them 8 years ago, but I don't have a video on that. So um yeah, guys. So I will hopefully be making more videos here on this channel, my fitness weight loss weight loss fitness channel. And also I do have an appointment next week with this weight loss doctor that I'm supposed to see. I'm still in the whole hoping to get the weight loss surgery this year. Everybody cross your fingers because I do need it. In spite of everything else that I have, I do need to get rid of the weight. And so yeah, guys, I hope everybody's doing good on your weight loss journey. I see a lot of videos. I see a lot of people just that have just done amazing with surgery, without surgery. It like inspires me, and at the same time, like, I ain't gonna lie, I'm kind of like a hater, like because people are living their life, and I feel like I'm just here and I'm not living my life to the fullest right now at this weight. So hopefully soon, hopefully this year, I might have surgery. I'm not counting on it. I'm hoping that I do. So sorry, guys. I will talk to you guys soon. Sorry. I'm just like, ooh, I think it's the dogs making noises. Bye, guys. See ya.